Did you know that some cancers can be preventable? Have you been having abdominal pain or constipation? Or do you sometimes see blood in your stool and you're wondering what's going on? Have you been losing weight and you don't know what's happening? Well, could it be that you have colon cancer? Colon cancer is the second most common cancer in the United States. It is believed that about 100,000 people are diagnosed each year with colon cancer. Another 44,000 are diagnosed with rectal cancer. So colorectal cancer, 144,000 per year in the United States. On my show today, I would like to give you information on colon cancer. My name is Dr. Cooper Dockery. I'm board certified in internal medicine, and I want to welcome you to my show, Get Healthy with Dr. Cooper. On the show today, I have an expert, Dr. Zamir, who will talk to you about colon cancer. So don't go away, we'll be right back.
Welcome to Get Healthy with Dr. Cooper. Discover the secrets to amazing health and longevity. Learn how lifestyle medicine, the vaccine for chronic diseases, can profoundly influence mind and body. Learn simple solutions such as healthy nutrition, exercise, strong family bonding, stress management, and spiritual renewal will empower you to live a longer, healthier, and more abundant life. And now, here's Dr. Donna Cooper.
Welcome back. You are watching Get Healthy with Dr. Cooper. And the topic of our show today is colon cancer. What does that mean? How can you prevent it? And I have an expert on my show today, Dr. Zamir. Welcome. Dr. Zamir is a very good friend. Welcome, Doc.
Thank you. Thanks for having me here.
It's a pleasure, as always, to have you on the show.
Thank you.
Tell us a little bit about yourself. Where are you from, Doctor?
I'm from Pakistan, and I had my training in New York. I did my residency and my GI fellowship there. And since then, I've been here in the Valley for past 20 years. Currently, I'm with Renaissance Gastroenterology, and I see all kind of GI cases. My expertise mainly difficult colon polyp removal.
Difficult ones, right?
Yes, the flat ones and the difficult ones. Yes, this is my area of interest. And also my area of interest is in pancreatic biliary issues. That is my area of interest. Yes.
Doctor, you have been a good doctor. Most of my patients love you very, very well.
Thank you.
As a matter of fact, you've also seen my husband. That's how much I have faith in you.
Thank you. Thanks for your confidence on me.
So, Doctor, we're discussing colon cancer. Yeah. And I think it's the second most common cancer here in the United States. Tell us a little bit why we should encourage your patients to get screened.
Well, very important thing to know about colon cancer before I talk about the symptoms and everything. One very important point that I want to relate to my audience today is that colon cancer in the early stages do not give any symptoms. So this is a key point that I want to stress to my audience, that colon cancer in the early stages is symptom-free, meaning patients do not have any symptoms whatsoever. They're completely healthy and they're still harboring colon cancer in their colon.
So that is why patients should be screened.
That is why patients should be screened, because screening means that you're looking for colon cancer without any symptoms. If they have symptoms, then this is the diagnostic procedure. This is not a screening anymore. That's why we encourage screening at the age of 50 in order to catch colon cancer in the early stages so that we can cure the disease. And I'm using the word cure here, not treatment only. It means that we can cure the disease if we catch colon cancer in the early stages. However, as I said earlier, many patients tell me that, oh, I don't have any symptoms, so why I should be screened? My answer is, again, colon cancer in the early stages is completely symptom-free. Another common argument about the patient is that they tell me or mention to me that I don't have any family history of colon cancer. yes, you don't have family history of colon cancer, which is good. However, 80 to 85% of the colon cancers, they do occur in patients who have no family history of colon cancer. So not having colon cancer does not mean that you cannot develop colon cancer. As I said earlier, 85% of the patients, they do not have family history of colon cancer.
I'm very happy you used the word cure.
Yes.
A lot of people tend to believe once you're diagnosed with cancer, that is it. But catching the cancer early is important.
Yes.
So I want to let our audience know that if your doctor suggests screening, do not hesitate, because we have various modalities for screening the patient.
Yes. Yeah. We do have various modalities to screen for colon cancer with a couple of differences. However, the major difference between, I would separate it for educational purposes, screening methods into one, colonoscopy, and the rest of the other methods. So colonoscopy, you're achieving two things. Number one is the early detection of colon cancer and the prevention of colon cancer.
And the treatment.
And the treatment, because if you catch it early, you can treat it. However, with all other modalities, you can detect colon cancer, but you cannot prevent it.
That's right.
Now the question is that how we prevent colon cancer by colonoscopy. The answer is that when you're doing the colonoscopy, you are looking for small polyps. Polyps are like little growth from the inner wall of the colon, which ultimately can lead to cancer. So if I remove this polyp during my colonoscopy, I am preventing colon cancer, because cancer developed from those polyps. That's why this screening method is different from all other methods, because it can not only detect colon cancer in the early stages so that we can cure the disease, plus it prevents colon cancer. This advantage, no other screening test has it. That's why this is the gold standard for screening.
That's right.
Colonoscopy.
Yes, so I love that. But I also want to tell my audience that you can also prevent colon cancer with lifestyle. If you stay tuned, I will discuss ways for you to eat and exercise and manage stress to prevent colon cancer. So we're having other modalities. So colonoscopy is the gold standard. If it's negative, it's done once every 10 years.
Yes.
We begin at age 50.
Yes.
But if the patient doesn't want colonoscopy, then there are different modalities.
Yes, there are different modalities available. Actually, tier one, or the first obviously is colonoscopy. Second thing is every year FIT, fecal immunochemical testing. This can be done as an alternate for colonoscopy. Again, this has good sensitivity for the colon cancer detection, but as again I want to emphasize the point again that the FIT, or the fecal immunochemical testing, will not prevent colon cancer.
I agree. You know what, doctor? I'm going to take a break right here. Then we're going to return and discuss all the modalities. So let's take a break. We'll be right back after these messages.
Your doctor delivered some bad news, but the good news is Dr. Cooper's book, Get Healthy for Life, can save your life. Order today at drdonnacooper.com or call 1-844-343-8935. Dr. Donna Cooper invites you to connect with us. Like us and share our social media networks. You can watch repeat programs of our shows anytime on Vimeo. Find us on our website at drdonnacooper.com.
Welcome back to Get Healthy with Dr. Cooper. On our show today, we're discussing colon cancer. And I have in my studio Dr. Zamir, who is a gastroenterologist, an expert on the subject. Before a break, we were discussing screening for colon cancer, and you discussed colonoscopy. Are there other modalities?
Yes, there are other modalities as well, as I mentioned earlier about FIT, which can be done every year. Besides that, then we have CT colonography. We have DNA testing, stool testing, commonly called as Cologuard. That can be done every 3 years as well. Flex sigmoidoscopy every 5 years. Then we have colonography, actually capsule colonography. This is also available. That can also be done every 5 years. But again, another important point to remember that if those tests are positive, like if you do a FIT and it is positive, you will need a colonoscopy again. If the polyp or something is detected, or if the Cologuard test or any other modalities tell you that it is a positive exam, then you will need a colonoscopy to get a tissue diagnosis.
That's right.
So these things need to be kept in mind before you choose what is the best modality.
Well, we already know the colonoscopy is the best, but sometimes the patients are hesitant.
Exactly.
And that's the only reason why I would suggest another modality, because I would tell them, if this is positive, then we still have to do the colonoscopy.
Exactly, yes.
So then if you're listening to me and you are hesitant, the colonoscopy is a very simple test. So please don't say no, but ask your doctor to guide your thoughts as you make your decision. Doctor, we're going to walk along here and we discuss more on colon cancer.
Yes.
Alrighty. So on this side, we are going to be looking at risk factors. Who are at risk for colon cancer? So let's put our first slide up on risk factors. And then I'll have Dr. Zamir talk a little bit about that. All right.
Okay. So risk factors for colon cancer, obviously age. As we grow older, we tend to develop colon cancer. A majority of the colon cancer, more than 85 to 90% of the colon cancer develop after age 50. So age is one risk factor. Then we have some other risk factors like consumption of meat, red meat, sedentary lifestyle, smoking, excessive alcohol consumption, obesity, insulin resistance, which is diabetes, and obviously if somebody has family history of colon cancer or family history of colon polyps, they're at increased risk.
I'm so happy that you began with modifiable risk factor. So apart from age, the first 4 factors you mentioned, they are modifiable. You did say consumption of meat, red meat.
Red meat.
You did say obesity. You did say diabetes. And smoking and inactivity. Can you imagine that all these are risk factors for colon cancer? Not only colon cancer, but all type cancers. So as you listen to us, as you listen to the show, Get Healthy with Dr. Cooper, you'll realize that there are many diseases that you can actually prevent using lifestyle modifications. Exactly. All right, let's move to the next slide. Let's look at some of the symptoms. And you did mention that sometimes there might be 0 symptom.
Exactly. This is the key point. Actually, this is my message to my audience that colon cancer in the early stages is symptom-free. It does not have any symptoms. However, when the symptoms started to occur, usually it is too late. That's why it is important that look for those symptoms very carefully. The symptoms are abdominal pain, significant progressive constipation, which is not getting better, bleeding of any sort. If you notice blood from the rectum, this is a red flag, is a warning symptom. Don't ignore it. If diarrhea, weight loss, fatigue, iron deficiency, anemia. That's why you feel fatigue and tired all the time. So change in bowel habits, meaning you were having constipation, now you're having diarrhea, or vice versa. I mean, all those things are potential.
What about pencil-like stool?
Yeah, I mean, this is also, though it's not specific, but it is seen in any kind of obstruction. If there is an obstruction, then it can be a pencil, thin-shaped stool, which Dr. Cooper just mentioned, and these are important symptoms that we really need to look into it.
Right, and as you scope your patients, we're going to look at what the actual picture would
inside,
be inside.
yes.
All right, so let's go to the next slide.
Sure.
All right, there we go.
Yeah, here you can see that this is the colon lumen inside. We are actually inside of the colon, and here you can see is a polyp right there. And this is obviously a growth from the inner wall of the colon, as I was mentioning earlier in the beginning of our talk, that this is the precursor for colon cancer. So it does not belong here, it has to be out. And we can definitely take care of it during this exam. And here, as you can see, there is a snare going around this polyp, and this is my snare. You can cut it and take this polyp out. And by taking this polyp out, you're preventing colon cancer.
There you go. Let's see the other slide.
And here you can see this is a difficult, as I told you earlier, that my area of interest is difficult colons, where technically they're difficult to remove. So here you can see it's a kind of a flat polyp, though it's not large. We can remove even much larger polyp than this, but technically this is difficult to remove, and sometimes it is difficult to be detected as well, because they tend to be very flat. So we have different ways to handle this kind of problem, and what we do is that we inject to raise this polyp so that we can remove it. So this is called flat polyp.
That's right. Any other slide there? There you go.
And this is something which we all don't like to see. Here you can see that this is ugly kind of lesion. You know, there's a lot of thickness, and you know, the mucosa looks abnormal. And here you can see a mass which is covering the entire lumen of the colon. This is a colon cancer. Sometimes we can, instead of having a large lesion, you can see a small portion of the colon. This is also looks like a cancer. You biopsy it during colonoscopy, that will give you the diagnosis. Same thing here. You can see a large mass inside the colon, which is obvious colon cancer.
Right, right. On the show today, we're not going to discuss treatment except removal of the lesion.
Yes.
One of the ways in which we can actually surgically treat this cancer is removing part of the colon.
Yes, exactly. So once you have anybody has a diagnosis of colon cancer, that does not mean that you know, it is like a death certificate.
No.
Or no, that's not the case. We do definitely have treatment available. However, it entirely depends on what stage you're diagnosing the disease. If it is early stage, there are 4 stages of colon cancer. We call it as, you can call it stage 1, 2, 3, and 4. So up to stage 2, just the surgical resection is good enough. However, when there is any involvement of the lymph nodes, which you can only tell after surgery, if there is any involvement, then besides the surgical removal of the cancer, you also need chemotherapy. However, the 4th stage is a stage where the colon cancer has spread to the other areas of the body, especially the liver. That is the type of or stage of the cancer where we cannot treat the patient with the curative intent, meaning that this disease at this point is not curable. However, we have chemotherapy available that can definitely control the disease.
Very good. Doctor, I want to thank you so much for being on the show
You're welcome.
today.
It's my pleasure.
And this is not a death sentence guide. I want you to realize that you can actually prevent cancer using lifestyle modification. So I'm going to take a short break. You don't go away. Stay right back with more on colon cancer. Thank you so much, Dr.
You're
Zamir.
welcome. Thank you.
Cooper Wellness Center now offers a wide variety of vitamins and nutritional supplements. Omega-3 protection for the brain, coenzyme Q for your health, turmeric, the wonder supplement, great for joint pain, vitamin D3 to promote healthy bones, plus many more multivitamins for women and men. Find these quality non-GMO supplements at great prices online or at Cooper Wellness Center. Live healthy, live smart.
Are you tired of being sick and tired and ready to take back control of your health? If so, Dr. Donna Cooper and her team are ready to help. To order her books or the DVD series Get Healthy for Life and 14 Days to Amazing Health, call 1-844-343-8935 or go to drdonnacooper.com today.
Hi everybody, welcome to my kitchen. Now today in the show we were discussing colon cancer. And you know you can actually use food as medicine. So I have a very simple recipe for you. This is hummus. Have you ever heard about hummus? Hummus is made from chickpea. Chickpea is high in fiber, high in protein, good fats I'm going to be using as well. You can follow me on the screen, so let's start. So I'm going to be using 2 cups of chickpea already cooked and drained. I'm going to put it right here in my food processor. All right, so this is my chickpea. Then I'm going to be adding my onions. Now, I like to use the onions somewhat roasted. So if you like onion, you can put a lot of onion. The onions are there. Then 2 cloves of garlic, chopped. All right, and that I am now going to add my tahini. Now, tahini is made from sesame seed. It's similar to peanut butter. This has good fat, the omega-3 fatty acids. So if you don't want to get heart disease or even colon cancer, this is good fat you can use. Now, if you're talking about Mediterranean dish, it's never complete without your lemon. So I'm using lemon juice, about 1/3 cup or 1 large lemon. Then to that, I'm going to be adding a cup of water. All right, so I'm adding my water there. Then I'm adding some cumin. All right, so this is the cumin. And then I'm going to be adding a pinch of salt. Now remember, too much salt is not good, and we're using sea salt. Sea salt has more minerals. Then for color, I'm doing roasted pepper. Alrighty, very simple dish. I'm going to blend all of that together. I'm going to process this. So let's see what happens here. All right, so we're going to process this. Now you can check the consistency to see if it's too soft, it's too hard. If it's too hard, you can add some more water. So I'm checking here. This is very good for me. Looks very delicious. All right. Now, how do you consume hummus? I have the final dish already prepared right here for you. So this can be used as a dip. It's actually a dip. You could use your pita chip. You could use vegetables. Remember that if you really want to prevent colon cancer or any disease, chronic diseases, lots of vegetables. So don't hesitate to use your green vegetables and just enjoy as a dip. Let me try this that I prepared earlier. Delicious. So if you want more recipe, go to my website, drdonnacooper.com. Hi, meet Sarah, a normal girl like you. But Sarah had a big problem. Sarah was overweight and thus increased her risk of dying young. But luckily for Sarah, she discovered Dr. Cooper's complete weight loss solution, and now the problem is gone. In this solution, there's a set of DVDs, 40 cooking videos, exercise DVDs with exercise band, Dr. Cooper's book 14 Days to Amazing Health with over 100 delicious recipes and helpful tips. What are you listening to me for? Listen to what they have to say.
I was able to lose 20 pounds, I didn't want to, which helped me to drop my high blood pressure medication. My mother lost 50 pounds and no longer takes diabetic medicine through the program.
And I've learned a lot. I've learned that I can prevent any disease by having a healthy lifestyle. I lost 8 pounds, yes.
I came to Dr. Cooper. I had diabetes. Within maybe 2 months, I was doing better. I'm off my medication. I continue to do exercise and follow a diet. Follow Dr. Cooper's directions, and everything will be okay.
For only $79, we'll send this complete kit to you. Go to my website, drdonnacooper.com, or call 1-844-343-8935. Friends, you have heard much about colon cancer. Most importantly, that colon cancer can begin without signs or symptoms, that colon cancer is curable, and that most of the risk factors are modifiable. Your diet, exercise, losing weight, avoiding diabetes, these are risk factors that you can modify. There is always hope, and that is why I'm here to give you hope. The Lord says, be anxious for nothing, but you should pray and ask for help. You should also do your part by living a healthier lifestyle. I have 2 books that I want to present to you. In my book here, Get Healthy for Life, I have 9 secret pillars for health. If you read them and apply them to your life, you can prevent many diseases, even cure diseases. In this book, 14 Days to Amazing Health, I challenge you to take 14 days and change your lifestyle. In this book, I have over 100 healthy recipes. I have an exercise program. I have stories about my patients that have done well. If you'd like to change your lifestyle, then go to my website, drdonnacooper.com, and click on the link to this book and buy this book. And I can assure you that your life will be changed. Keep following me every day on this station for more information on how you can use simple lifestyle modification to reverse, prevent, and cure chronic diseases. May God continue to bless you and your families.
This broadcast was sponsored by Cooper Wellness Center and Faithful Path International Ministries. For more information on how to become a patient or a sponsor, please contact us at 1-844-343-8935 or visit our website at drdonnacooper.com.